Hi, everyone. I'm Leslyn Keith with the Lipedema Project. I'm the president of the board and the director of research, and I'm happy to be here with you again today. I'm here for twice a month, usually the first and third Thursday, to talk about different papers, different research that is coming up recently about lipedema or of concern to people who have lipedema. And so I have a really nice paper here I want to talk to you about today. This one is actually written by Dr. Alexandre Amado out of Brazil. He's a surgeon and specifically works with women with lipedema in Brazil. And he's written lots of papers and done research projects. And so he has put out another one that just came out in February of this year, 2023. And so this one is called The Association Between Lipedema and Attention Deficit Hyperactivity Disorder. We're going to have a link in the comments below. You can get, this one is open access, so you can get the entire paper online. But definitely let me know if you have difficulty getting to it. I'll give you my email coming up here as well. But there is the name of the paper, and the link to get to the paper is down below. And so this one, as you could tell from the title, what they were looking for in this is there an association between lipedema and ADHD or attention deficit hyperactivity disorder. So for those of you that have kind of been looking at lipedema for a while, you know that there seems to be several conditions that seem to show up a lot with women who have lipedema. For instance, hypothyroidism, Ehlers-Danlos syndrome, and various conditions like that seem to show up a lot. And so he wanted to know, Dr. Amato and his colleagues wanted to know if ADHD would show up a lot with lipedema. And I guess I should let you know too that one of the reasons why they even started looking into this is because that both conditions seem to have high incidence of inflammation. So there seems to be inflammation with lipedema, and there also seems to be inflammation or higher levels of inflammation in ADHD. So this is what first triggered him to look at this, and they examined that. Let me just do a short thing on what is ADHD. And so I looked this up online. ADHD, it's a very common disorder that affects children, but it can persist into adulthood. And some of the symptoms of ADHD include an inability to maintain focus. So going from one thing to the other thing to the other thing. And then hyperactivity is a symptom if you have ADHD. And this means excessive movement, fidgeting that just is not appropriate to whatever the setting is. If you should be, sitting quietly and focusing on something, but there's an inability to do that. And then there's also a symptom could be acting with excessive impulsivity, just really not having any impulse control, just acting out and doing things without even considering the ramifications. So that difficulty with impulsivity. And there's other symptoms as well, but these are some of the main ones that we look for in ADHD. So how did they get the participants for this study? Well, they recruited them from this nonprofit Brazilian website for lipedema. It's called lipedema.org.br. And so they recruited women who had gone to this website, and they included people that had they all had to be female, but they could have or not have lipedema. And so they were looking for people who were at least 18 years old. So you had to be an adult to participate. You had to sign a consent form. You had to, the online surveys that they had you complete as part of the study, you had to take at least 5 minutes to complete the 2 surveys. And I'll tell you a little bit more about what those surveys were. But if you completed them in less than 5 minutes, there was a worry that you didn't give it the amount of consideration that it needs. So they excluded those people. And so they ended up with 354 women, and the average age was just under 37 years old. Average weight was about 173 pounds or 79 kilograms, and the average BMI was 29.4. So let me tell you a little bit about these two surveys that they filled out. But first I will tell you that there was a total of 547 women filled out the surveys, but 190 were excluded because they didn't meet the exclusion criteria. Mostly it was that they finished them too quickly. They didn't take at least 5 minutes. And so the two surveys were, one was a lipedema screening questionnaire that Dr. Amato and his colleagues developed themselves. I think actually some from information they got from the Lipedema Project. And they validated it with the Brazilian population. In some previous papers, I think I've done it, evaluated their papers on that in the past. And when they validated that questionnaire, they found that it took at least 3 minutes to complete. And so, and the results of taking this lipedema screening questionnaire would either put you into the lipedema group or in the group that does not have lipedema. So the questionnaire is found to be pretty valid for helping to distinguish people who have lipedema or don't have lipedema. But again, it's a screen, so it's meant to be then being coupled with a clinical in-person diagnosis to figure out if you really do or don't have lipedema. But this was an initial screen. They took that, and it took them at least 3 minutes to complete. Then the other study was the Adult Self-Report Scale, or it's called the ASRS, and it's available in Portuguese, so they're able to use it with their population. And it's 18 items, and it questions you about different ADHD symptoms. And so this one takes an average time of about 2 minutes to complete. So there, with both of them, you need to take at least 5 minutes to complete that. And when you complete that, it'll give you a positive or negative result. But positive, you're likely to have ADHD, whereas negative, probably not. And so let's look at some of the key results. So in the group that was determined to likely to have lipedema, that was 130 of the participants, and their average age was 38 years old. Average weight was 182 pounds, which is just a little over 82 kilograms, and their BMI was almost 31. The group that did not meet the criteria for lipedema, there was 224 participants in that group. Average age was 36, average weight 168 or 76 kilograms, and average BMI was 78.5. So you can see everything was a little bit lower, but very, very similar. And it turned out that 77%, that was 100 out of the 130 participants with lipedema, had the symptoms of ADHD. That's pretty high prevalence in this particular group. And only 54%, or 121 out of 224 participants in the non-lipedema group, were positive for ADHD symptoms. So another interesting result that they had, that there was a positive correlation between how severe the lipedema symptoms were to how severe the ADHD symptoms were. So that tracked, they not only had that correlation between the two, but then the more severe of each correlated with more of the severe of the other condition as well. So then, because they took that ASRS survey, then they were put into the positive for ADHD and negative for ADHD groups. And so looking at the positive group for ADHD, average age was 36, average weight was 173, 78 kilograms, and average BMI was 29. Now look at the negative group for ADHD, 38 years old, 173 pounds and 29.5, almost exactly between those two groups, positive and negative for ADHD. yet we did have a much higher prevalence in the lipedema versus the non-lipedema group for ADHD. So that was interesting. And then the authors talked about that in the literature, when you talk about ADHD, there is a feeling that the symptoms seem to decrease with age. And so in this study, that seemed to be validated there, even though the positive group was 36 and the negative group for ADHD was 38, there's only 2 years difference. So they felt like that was pretty much that they did not seem to decrease with age. So they might still have issues with it. The authors said that maybe the reason why we feel like it decreases with age is because we're better at diagnosing and catching ADHD and treating it as a child. And so then symptoms are better managed by the time the person reaches to adulthood. So, you know, it's conjecture. We're not sure. Then let's see, they looked at, I already told you that the initial reason why I looked at that was because that both conditions have an issue with inflammation, and they seems to be the trigger for it. But the other thing that both conditions have is anxiety and depression. So both of these diagnoses tend to have a higher risk or higher incidence for anxiety and depression. There's one study that found that 61% of patients with lipedema had anxiety and 39% had depression. And these are the similar things that are found in ADHD. So there could be some overlap there as well. And then there has been research that shows that people with ADHD tend to have poorer surgical outcomes. And they were talking about bariatric surgery. Poor follow-up, not going back to see the surgeon after the surgery was more prevalent with someone who had ADHD versus someone who didn't. And so when we think about the surgical interventions that we sometimes do with lipedema, so we tend to do liposuction surgeries. You might have undergone a bariatric surgery for lipedema. And if that could have an impact on the outcomes of if a person with lipedema has these surgeries and they also have ADHD, you can have a poorer outcome with those surgeries. So it's important to know about this. So the conclusions, there's a higher prevalence of self-reported symptoms of ADHD and self-reported symptoms of lipedema. So there might be an overlap between those conditions, and the role of inflammation in both of those conditions needs to be looked at more. And then the authors say that it would really be beneficial to incorporate mental health conditions, considerations when into treatment for lipedema. Women with lipedema should be screened for things like ADHD to really improve their outcomes with treatment for lipedema. And the authors also suggested that the healthcare professionals that are involved with lipedema need to have increased awareness about ADHD and the possibility of a higher prevalence of ADHD with lipedema. And so this needs to be looked at and addressed, hopefully prior to doing any surgical interventions. So really important. Couple of limitations with the study. As you can imagine, any study has its limitations, and it's always good when the researchers themselves acknowledge this could be a potential problem with this study. So one was that they talked about that levels of inflammation can fluctuate. And so when you have this cyclical or up and down characteristic of inflammation, well, it can increase or decrease the symptoms of the ADHD or the lipedema. And this could have been happening. So someone could have been at a better part of their cycle for either condition. And so the symptoms weren't as severe, or they could have been more severe. And so this could change the results of the study because they could have been somewhere else on that cycle of inflammation. Also, the authors suggest that both of these instruments that were used were self-report surveys. And so this requires a certain level of self-reflection and introspection and seeing what's going on with your own body and how you're dealing with your environment and other people. And so that may be an issue for someone who has ADHD. So that could skew results if they're not able to do some self-reflection like that. Also, because this was recruited for people online, they were going to website to find out more about lipedema. Could this have been a selection bias because people going to that website may have more severe condition? They're really trying to figure out, learn more about lipedema, what they can do. And that person may have a more severe presentation, which then, could skew the results to a more severe side. So you just don't know how much that could be skewed by something like that. And then the last one was that both of these conditions, or both of these surveys, they're self-report, and they're usually corroborated with a in-person clinical exam, which wasn't done for this. So, so that is a level of confidence in the actual diagnosis of ADHD or lipedema that we don't have. And so again, that might skew the results. So it's important to know that type of thing, that might change the results in your study. And I just want to look and see some of the nice comments that you have on here about this study. Marilee, it's warm in the Pacific Northwest. That's good. And let's see. Julie, I have never been officially diagnosed, but have shown signs of ADD. And this is attention deficit disorder without the hyperactivity, which is totally possible to have as well. And my current primary care doctor says that, yes, I probably do have that. So, so that's something that I'm not sure if this self-report survey works for someone who only has ADD and doesn't have the hyperactivity component, but that would be interesting to know. And then Julie also says, I had the hyperextension issues that seem to go with lipedema. So that is, she's talking about the hypermobility of joints that tend to show up with lipedema, definitely. So thank you for your comments on the study. And as usual, I would love for you to, if you have any questions about the study, or if you have a suggestion for a paper you would like me to review, I have a queue of quite a few papers lined up that I still want to do, but I'm always looking for new stuff. People send me papers all the time that I didn't see that one. So if I may already have the one, but if I don't, I will thank you for sending it and bring it to my attention. So that is, just email me at leslyn@lipedemaproject.org and let me know something you would, or maybe you just have a topic and is there a paper on this, and I'll look for it. So let me know. And just a quick announcement. Many of you know that we do have an online virtual event that's coming up. It's March 31, April 1 and 2. It is a fresh take on lipedema and lymphedema solutions. It's going to be 3 days of wonderful interaction with the whole community to talk about different solutions for lipedema and lymphedema. And I think if you go to the link that we're providing for you, that you will see that, go there and check it out, because it is, we're just having some wonderful people there. I think you would really get a lot of value out of joining us. We also want you to be there to contribute and to engage with the community, and so we can all learn from each other. So check that out and register. We'd love to see you there. And I'm just looking to see if there was also any other questions on there. No, I'm not seeing anything else. So I think that is going to be all for today. Thank you for joining me today. And I look forward to being with you again next time and doing another research update. See you soon. Bye-bye.